Welcome to the Innovation Accelerator podcast, brought to you by Innovacer, the health cloud company. We're on a mission to connect and curate the world's healthcare information to make it accessible and useful. With Innovacer, everyone works in the service of patients like never before as one. Visit us online at innovacer.com.
Welcome back to the Innovation Accelerator podcast. I'm your host, Steve Ambrose. On today's show, our Chief Transformation Officer, Dr. Paul Grundy, will be having an engaging conversation with Dr. Marion Ball. Dr. Ball is currently the Executive Director at MICHI, or the Multi-Interprofessional Center of Health Informatics at the University of Texas in Arlington. Selected as one of the top 50 most influential IT professionals over the last 50 years by HIMSS, Dr. Ball is an author and editor of over 25 books and over 230 articles in the field of health informatics. She's also been recognized as one of the most powerful women in healthcare IT by Health Data Management, and we're fortunate to have her with us today. Dr. Ball, thanks for taking time out of your busy schedule to be with myself and Dr. Grundy and our show listeners. And before we get started, I'd like you to share a bit about your current role and focus, as well as the career journey that brought you to this point.
Well, first of all, let me thank you so much for inviting me to be part of this interview. And I look forward to sharing with you some of the adventures and some of the things I'm doing at the University of Texas in Arlington at our Multi-Interprofessional Center for Health Informatics.
Thanks for that. And I'm going to hand it off to Dr. Grundy and yourself to take it from here.
Marion, according to U.S. data, less than 30% of the world's researchers are women. And the U.S. Census report, women account for only 27% of STEM workers in the United States, despite making up nearly half of the country's workforce. Marion, do you consider yourself an inspiration for women in healthcare technology?
Well, I think in a way the statistic that you read, Paul, is obviously from the census data. But if you count the fact that nurses, you might not want to put them under the STEM category, but they constitute more than half of the healthcare workforce. They're the biggest population. In the nursing community, there's been tremendous, interest and advancement in nurses using technology in many ways. And it's not only in the nursing community where there are a lot of women. You have a lot of women also in the area of public health. And in public health, we have, of course, I'm sorry to say, had a failure in the last pandemic. And we need to see how we increase the abilities of public health informatics to transform that as well. But in all of these areas, interestingly enough, Paul, there are a lot of women. And as you know, I've been writing textbooks for the last 25 years. And the books that we have on nursing informatics and the courses and the number of people that are going into these fields is really improving since I went to school. So I feel very, very encouraged that even though we use the word STEM, we can expand that, particularly if we're looking much more into the area of multi-interprofessional, as our center is all about. And even if we think about expanding that further into precision health, in what I mean by precision health is, the integration of multiple disciplines. That's including analytics, the life sciences, innovation for the development of individual maps to prevent illness and diagnosis and treat diseases. Where do you see a lot of this area? Those are all women, not primarily, but very much involved in that. I've been a very big proponent of seeing how to bring women into the field and to write books to encourage them. I think one of the things that I neglected to say a little earlier when we look at the expanse of how this field is developing, I wanted to also say that the field, there are big fields that are just blooming. For example, the whole area of public health informatics. We're going to see huge fundings coming, given the fact that we messed up so much the pandemic with the COVID situation. But at the same time, in my center, we cannot just look at the traditional aspects of informatics and now joining with that public health informatics. We need to see, and this is what I've done in our department, and I have a wonderful co-director, Dr. Wilson, who's working with me, and somebody who we've brought in, namely in the whole biotechnology and systems biology direction. We've got to look in, how do we integrate the human genome? How do we know what are the next steps? As you know, in medicine, we talk about best practices. Paul, that's a very poor misnomer. I mean, best practices for you and best practices for me is not the same. So we really need to look at what's my gene configuration? What's yours? How do I bring that together? How do we bring the patient in? How do we integrate that in the public health field? And in all of these areas, you're finding more and more women stepping up to the plate. So indirectly, I'm turning a little bit on your question just to add a little bit more substance to the fact that I am very encouraged in seeing women come into these incredible professions. Just now, we're putting a certificate program together here at UT, at the University of Texas in Arlington, for example, in telehealth. Well, who's using telehealth? Sure, the physician is, but that's not going to be possible without bringing the nurses in, bringing the social workers in, bringing the technology in, which would be engineering, computer science, bioinformatics. So we are at the threshold of a fabulous revolution, and it is a revolution. It cannot evolve anymore. We need to transform healthcare so that it is a healthcare system, as I started the discussion, and get rid of the concept of a sick care system. So it's a long way around, but I think the mentoring that I've done has been a real joy and pleasure. When I went to college, when I graduated from high school, which is a long time ago, there were 3 professions women could go into. They could become a nurse, a teacher, or a secretary. Now, if you go to medical schools, 50 to 51% of the people in medical school are now women. If you go to nursing schools, of course, we're bringing now, even changing there, 10 to 15% of men are coming into the nursing school. If you look at dentistry, 60% go to law school. So I am very encouraged for women in not only in healthcare, but in the workplace in general.
Well, when I was with you in China, I saw you being ganged by hundreds of women. Because your books have been written, I think, in about 47 different languages.
Well, not that many, but 7 or 8 languages. That's true.
but the point is that a lot of the world's population has really gravitated to the work you've done, and to say nothing about your leadership in Tiger. Give us a bit of how you've sort of motivated women in technology with your amazing development of the Tiger program.
I will be glad to. That's one of my favorite subjects. I like to start new things. And going back to 2006, that's when our president at the time, Bush, was making a major pronouncement in that he said he was going to open a new position, and the position would be an office of the national coordinator. It didn't have the same name, but it was to put the czar together who would handle the whole aspect of technology. Well, we were very excited. I was at that time at Johns Hopkins, a professor there. A lot of us from the College of Nursing and Medicine, by the way, went to the the convention center in Washington, D.C. to hear this great announcement because, of course, it was something we were interested in. Well, let me tell you, it was such a disappointment to hear all of these congressmen, all of these people from the AMA, from the professional organizations, get up and talk about medical informatics. Not one mention of the biggest force that was using technology, the nurses. So, like a lot of women do, we decided this was just too much. We're going to lunch. So we went to lunch at the Cosmos Club. And at the Cosmos Club was born the fact, they said, even we're just a few women, and they were just women this time, we said, we're going to start an initiative which we're going to call Technology, Informatics, Guiding Educational Reform, and starting with the nurses. And that acronym is TIGER. So Tiger grew. We got the support from the Dean of the College of Nursing at Johns Hopkins. We had a extraordinarily active group of women. The fourth edition of one of my books, I list every one of them. We had over 1,500 volunteers who said, we are going to put this Tiger on the map. And we had a conference at the Uniformed Services University in Washington, D.C., which was chaired by Michelle Troseth and the Dean of the College of Nursing at the time, Pat Hinton Walker. And I have to tell you a funny story, which was great. We said we're only going to invite 100 people. And of course, when you put a limit on it, all of a sudden, everybody else wanted to join too. But we said, look, we want representation from all of the organs, the wound care nurses, the operating room nurses, the pediatrics. So they all, and we were very fortunate. We were very dedicated. These women volunteers, all of them. We raised money from the National Library of Medicine, from the Robert Wood Johnson Foundation. We had something like almost $350,000, $400,000 that we raised to put together a major conference to see how do we strategize to make this happen. Well, the strategy meeting happened, as I mentioned a few moments ago, at the Uniformed Services Division Hospital in 2006. Well, everybody came. We all stayed at the Marriott, and you know Washington well, right across from from USIS. And when we went onto the campus, we had bus transportation, everything. You know, everybody is using their cell phones. You know, we're talking away. Everything went dead. When you go to that university and you work there, you cannot use any technology. Best thing that ever happened. So for 3 days, nobody could do anything else. They had to concentrate, and we had a good facilitator, and that grew. And we eventually were just an initiative. Then it became too big, and the Health Information Management Systems Society, HIMSS, was willing to take us under their umbrella. It has grown to the point where now we've got an extraordinarily good executive director, Tori Shaw, and we are now not only doing this for nursing, we are doing this for all of the health professions. We've written textbooks on it. We've gotten money from the European Union for curriculum. What are the curricula that need to be used? Again, not one shoe fits all. What does a charge nurse need? What does a physician need? What does a psychiatrist? So and this was published open source with the blessing, as I said, of the European Union. And now this initiative is in 33 countries around the world. So you just can see the power of women sometimes really pays off. And of course, we've got many wonderful men that have supported us as well.
So do you see a distinct difference between health informatics and nursing informatics, or do you just see engaging nurses more in the overall role of health informatics?
It's a really good question, Paul. It's just a subset of the field of health informatics and intelligence. You have nursing, you have dentistry, you have veterinary medicine, you have all aspects. And what we haven't talked about, like the business school, what is the business aspect of healthcare? All of the insurance, you've got the provider and the payers. All of those have to work together. And not to be forgotten is the patient. For God's sake, the patient is in the middle of all of this. And if you think of the patient has access or needs people. That's an ophthalmologist, a pediatrician, a internist, a podiatrist. I mean, everybody. And you have mental health aspects. You've got aspects of public health, population health. They've got to work with the pharmaceutical industries, pharmacy informatics. And actually I'll mention, because I have a fantastic advisory board for our center, of which Paul honored us, and we have mostly Academy of Medicine people who have volunteered to serve in that capacity. But Paul, you'll be interested to know that it's now the 60th anniversary of the Kaiser Foundation beginnings that Maury Cullen put together during the Second World War, as you will recall, to help Kaiser build the boats, the ships that helped us win the war by starting multiphasic health testing, which was really the beginnings to say, look, we need to go from sick care into healthcare. It started then, and that's being celebrated by the Kaiser Foundation this week. Anyway, just a little sidebar.
So when you mention all of those, all of those various professions that are really going to have to integrate in what we now think of as team-based care, where it's going to be a team sport. I mean, I think that really brings home the need for the system integrator, the place in the delivery system where that data is pulled together and everybody sings off the same sheet of music. We call that the medical home, and you and I know worked on that extensively. But, people get confused when they hear that term. They think of it as the home for the patient or the home for the doctor, but it's the home for the data. If you're going to have data and that data is going to need to be acted on by disparate sources, that data needs to be pulled together into one place. And, the place that it should be pulled together, I think we both agree, is in that relationship with the trusted healer and the patient, right? I mean, there is where it has to be pulled together. I mean, you talked about drug-drug interaction earlier and about the complication of that. I mean, that's sort of what got me started in this whole movement around patient-centered medical home. Is our CEO almost died of a drug-drug interaction, right? I mean, he had a doc for every organ system with no adult supervision. And so I think that, the fact that, we're now talking about, folks who understand healthcare data from all these various fields and pulling that together into a meaningful use of that data is really, really important. I was pretty frustrated by the time I left IBM. And when I ran across Innovaccer, they were doing all the things that I'd hoped we could have done at IBM in pulling that data together. And I know you've had a chance to look at it. I was wondering if you had any comments on where we should take that. What do we need to do to support our vision of that third leg of the stool, of really making it a plan for every patient across that team-based care?
Well, Paul, you really put your finger on it. And I mean, why is it that we don't have that problem in Sweden or Norway and even in Canada? And the bottom line is, which is, it comes down to politics, in that what we don't have in our country, we do not have a unified patient identifier. So that means, how are you going to integrate and do the interoperability, what is needed in an efficacious fashion, so that we mentioned earlier that if you go to Johns Hopkins for X-ray and then you go to the ophthalmologist at the University of Maryland, that those two hospitals that are just not even 10 miles apart from each other can't exchange any of the data. I mean, it's insane. I should maybe say that out loud, but those are the kind of issues that we really have to address. Now, we are looking and moving, and it's also been part of the public health initiatives. We are starting to see how we have HINs, health information networks. Some states, for example, Indiana has been very successful. Maryland does have that. It's kind of a halfway house where all of these, let's say, hospital information systems, Cerner systems, Epic systems, excuse me, are all able to send their data to a HIN, and then wherever the physicians are, they can go to the HIN and through that HIN get the information they need. But a lot of it is still very, very complicated. And not only that, it was suggested in the 60s that the Social Security number would be used for that in our country. Well, I mean, everybody was concerned about privacy, confidentiality, etc. But when you are born in Sweden, you get one number. And I think you particularly, Paul, spent a lot of time also when you were in the State Department in the Nordics countries. They do not have that issue. So that the patient in many ways gets better care because you can get the information that you need when, where, and how you need it. Anyway, Paul, that's my story on that one.
I took the leadership of Kaiser over to Denmark, where I've been a healthcare ambassador for the past 20 years. And, every bit of information about you by law is in your record, and you give that permission to other people to use that information. And so any physician can cover for any other physician having all the information. It's phenomenal. You talked about interoperability and about some of the changes around that. I don't know if you're familiar with the 2022 TEFCA, release from ONC, but, any comments on those sorts of government issue concerns that are coming down the pike that might help us? Any thoughts on what's going on?
Yeah, well, you've got HL7, you've got FIRE, all of them are initiatives, but we really haven't gotten to the point where there is a blanket saying, look, we need to see how do we handle that system. And I'm not that familiar with that particular initiative at the ONC at the moment. But Paul, if you want to expand upon that, that might be of interest. But we're not where we should be. That's for sure.
Yeah, for sure. So, Marion, thanks so much for being with us today. It was just a pleasure, and we so appreciate what you've done for health information technology and particularly for women and nursing health informatics.
Well, Paul, it truly has been my pleasure to have the privilege to speak with you, to share my thoughts. And indeed, I want to take hats off to you for what you've contributed to our field of health informatics. Again, it's a special treat to be able to spend time with you. So again, thank you and have a good rest of the day.
Our thanks to special guests, Dr. Marion Ball and Dr. Paul Grundy for their time and discussion today. And for our listeners, don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned to the Innovation Accelerator podcast for more shows covering the healthcare IT topics that you care about. For more information on this and other healthcare IT topics, please visit innovator.com. I'm Steve Ambrose, wishing you a great day.
You've been listening to the Innovation Accelerator podcast, brought to you by Innovator, the health cloud company. Don't forget to check the show notes for links to related resources and other information. And stay tuned to the Innovation Accelerator podcast for more programs about the healthcare IT topics you care about. Accelerate your transformation and build the future of health on the Innovator Health Cloud. For more information, please visit innovator.com.